and the negative impact on children. Sustainable Development Goal number 2. This goal refers to the ending of food insecurities and improving sustainable agriculture. Food insecurity, who is affected by this? Those living in poverty, those who are very young, elderly, and the minorities. Risk factors, this is the increase in food costs, increase in energy costs, increase in cost of living, and increase in unemployment. It is worthy of note that due to the COVID-19 virus, this has increased incredibly in terms of unemployment, those living in poverty, those not being able to afford food costs on unemployment, for those who are not receiving benefits. Food insecurities affect not only those directly suffering, but also indirectly as a nation. As referred to by RTI International, hunger impacts productivity, public education, and healthcare costs. So those who have food insecurities have a tendency to have more health illnesses, which requires them to call off from work even more, which then gives issue with household income, which then it's a vicious cycle, and then you have to deal with the cost of living and then possibly unemployment. Consequences of food insecurities. As of 2018, there were 11.2 million children in America living in food insecure households. This can increase the chances of stunting of growth, developmental delays, long-term setbacks, and eventually leading to a negative impact on the workforce. Again, another vicious cycle. Adults who suffer from food insecurities have poor health, which increases their illness occurrences, which then has a tendency to turn into chronic disease, and then possibly mental health decline, absenteeism, decrease in productivity. For the elderly, their health and cognitive abilities can decline very quickly when they are not able to have access to proper diet and nutrition. Chronic diseases occurrences increase, and then as well as exacerbation of those diseases if they're not able to access what they need. For instance, if you have a dialysis patient that cannot afford healthy food and stay away from the junk food that contains phosphorus, sodium, potassium, things of that nature, exacerbations of their kidney disease can take place. These three issues cause a need of increased use of health care when patients are unable to stick to their diabetic diet, and then they wind up in DKA and wind up in the hospital. A lot of things can occur with the elderly who already have comorbidities and don't have access to good food. So for the purpose of this, because it's such a broad topic, I've decided to stick with the impact on children. So there are several healthcare policies out there. One I was really impressed with was the American Academy of Pediatrics and the Food Research and Action Center, which created a policy addressing food insecurity, a toolkit for pediatrics, which basically boiled down to screen, intervene, and advocate. This needs to be done at any just as regular health assessment, so that we can quickly get these families in touch with government nutritional programs that are set up by the USDA, and finding other ways. Perhaps they just don't meet that criteria quite yet. They're not below enough in the poverty line. Several food banks are available in my community. We have blessing boxes all over town. We have loaves and fishes. We've got food banks, things of that nature. So even if someone doesn't meet SNAP benefits, WIC benefits, summer nutritional programs, after school nutritional programs, there's always something to be done, at least in our community. We're very blessed. Another thing that that there's a policy on is improving the adequacy of monthly SNAP benefits, trying to find ways to have these patients become applicable for these programs is incredibly important. In our community, if you qualify for SNAP, if you qualify for food stamps or anything like that, our children automatically qualify for lunch at school and breakfast, and also summer nutritional programs. Also, with the COVID-19 taking place, we've been blessed to be able to still feed the children breakfast and lunch every week. There's different bus stops, different places that you can meet up at, and they will give you a brown paper bag with breakfast or lunch for as many children that are in the home. The effect on children is astronomical. Without adequate nutrition, it's shown that children live more sedentary lives. They have increased issues with high blood pressure at young ages. Their dental cavities go untreated. They can be diagnosed with low bone density. They have increased issues with cold viruses and stomach aches. Decrease in mental and emotional health. These kids are stressed out. They're hungry. They know mom and dad are stressed out because they're not able to give their children the food that they need. It also causes educational development delays if they don't have those vitamins and minerals and incredibly important things within proper nutrition. Then it causes issues with these developments, and increase hospital visits. So why is funding and advocacy so important? Early recognition of food insecurity and connecting these patients and families to federal food programs decreases the complications within this vulnerable population. With an increased access to food comes an increase in health promotion and prevention of disease. If we can start with these kids early on, teaching them what good diet nutrition looks like, give them access to that good nutrition, then they're going to have better developmental and better growth processes, and as opposed to the stunting of the growth, and they're going to have increased mental and emotional health. So they're going to be set up for success, which is so incredibly important for us to be doing for our children. Food insecurities in the U.S. is a very prevalent issue, and children who live in homes with food insecurities have greater risk for growth stunting, increased occurrences of illness, decrease in development, and many other health concerns that we spoke about earlier. When proper nutrition is available and children are taught proper diet and nutrition, they will be set for health promotion and disease prevention in the future. Pediatricians and nurses should take part in the screen, intervene, and advocate during regular health assessments in order to intervene quickly. And pediatricians and nurses should also advocate by providing written commentary in regards to federal nutrition programs to legislation when new rules may harm or improve the programs. These are my references.